Our next speaker, Bob Yuhnke, has spent his legal career defending the public from the health hazards of air pollution in particular. And he's been a leading environmental advocate, calling on the EPA to more aggressively monitor highway emissions and to adopt requirements designed to protect the health of communities. And this plays right into what we just heard about the environmental impact statement and whether that statement is properly and adequately addressing some of the consequences, in particular related to air pollution. Bob?
The speakers later this afternoon are going to focus on the reason why we want to get highways out of urban environments. And most of their focus is going to be on issues related to the aesthetics of an urban environment and our ability to enjoy living in an urban environment. What I want to focus on are the health benefits of getting highways out of urban environments, because these have become much more a focus of national policy in the last few years than they ever were before. I have spent 25 years trying to get EPA to focus attention on the health impacts to communities that are next to highways. Beginning in 2010 with the Obama administration, we finally had an EPA that was listening. And they revised the national ambient air quality standards for two pollutants, nitrogen dioxide and fine particles, also known as PM2.5, to require for the first time in the history of the Clean Air Act, which goes back to 1970, that air quality actually be measured next to highways. Prior to that, the practice had been, even under EPA's guidance, for the states to put monitors out in urban areas, but in locations where they would not be influenced by highway emissions. So the air quality that was used to determine whether or not an area complied with the Clean Air Act had nothing to do with the air quality that communities next to highways were actually breathing. So for the first time, we are now in the process of selecting sites for monitors, and there's one now that's been installed down at I-25 and 8th Avenue, and there's another one to be sited within the next year, within this year, 2014, which will begin to generate data to tell us exactly what is happening to those communities that live next to highways. But we have some important insights already about what's happening in Denver. Just last week, the Denver Environmental Health Division released a report on the health status of the communities on the I-70 corridor, including Globeville, Elyria, and Swansea. That report is really a major eye-opener for me, and I've been working in this field for a long time. Let me give you some idea of what they're reporting. One of the evaluations of health outcomes that they've used is the years of potential life lost in a community. And what they've shown is that in those three neighborhoods in North Denver that are dominated by I-70, and also the mousetrap, which involves I-25 in Globeville, have a shorter lifespan by 3.5 years on average compared to the rest of Denver. That is not a marginal difference. That is a huge difference. If you think about it, for 15,000 people, that's eliminating 50,000 years of human lives. That means that there is something significant going on in these communities that is different than what is happening in the rest of Denver. Now, there are other health outcomes that they looked at. They report, for example, on the number of deaths attributable to cardiovascular disease by city council district. Now, there are 4 city council districts in the I-70 corridor. Now, those 4 districts have the highest death rates attributable to cardiovascular disease of all the council districts, all 11 council districts in the city. And the differences, again, are not marginal. They're talking, in those districts, anywhere from 213 to 275 deaths per 100,000 related to cardiovascular disease, compared to other districts in the city of only 160 or 180. So this is more than a 50% greater incidence of cardiovascular disease than other parts of the city. Again, these are very significant differences in health outcomes. For diabetes, the districts in the rest of the city have diabetes incidence of less than 5% of the population, and in these 4 districts, it's above 7%. So 5% below can be 4%, 3%, and here it's above 7%. With regard to obesity, in these neighborhoods, the prevalence of obesity is over 60% of the population in a state where obesity, we have the lowest obesity rate of any state in the union. And in the rest of Denver, it's less than 40%. And so one of the things I want to thank Maria Campos, I don't know if she's here today, but she lives right virtually under the mousetrap. She had 3 kids who went to Garden Place Elementary School, which is just a few hundred feet east of the mousetrap. And she was pointing out to EPA the other day when we met with them that one of the things that happens, because what I've had a hard time doing is putting together this asthma, obesity, cardiovascular effects. Why is this all happening in the same place? And she gave me, I think, a really important insight. She said, we know that we have many more kids, many more children with asthma than in the rest of the city. And so one of the things that we are very careful about as protective parents is not letting them go outside. Because if they go outside, they'll be breathing the pollution from the highway, which will make them sick, and we'll have to take them to the hospital, which is one of the things that showed up in this Denver health study, that the frequency of hospital admissions, emergency room admissions of children under the age of 20 for asthma in the emergency room is 40%, is 40 per 1,000, whereas in other parts of the city it's 28 per 1,000. So that's, again, a much greater health impact. But the point she was making is our kids are obese because we don't let them go outside and play, and we can't let them go outside and play because it'll make them sick, and then we'll have to take them to the hospital. And so they end up being candidates for cardiovascular disease. Well, this all fits together. This is what we are doing to these communities. It's not their fault. It's the result of exposing them to these pollutants. Now, the air pollutants that come off of highways is what EPA is now finally trying to get a handle on. And it's been a long time in coming, but it's finally coming. There are 92 toxic air pollutants emitted from tailpipes. Those include some that you'll probably recognize, like benzene, others you may not recognize, like 1,3-butadiene, acrolein, formaldehyde. These are pollutants that cause cancer. They're known to have other adverse health effects. And then there are the more traditional air pollutants that are the focus of more regional scale pollutant control strategies, like carbon monoxide from tailpipes, nitrogen dioxide, PM2.5, and ozone. So what we're doing is exposing these communities next to highways to a mix of pollutants that doesn't exist anywhere else. Communities next to industrial sources tend to be exposed to a handful of these pollutants. The communities next to highways are exposed to all of them. And the other thing that this study showed is that those communities next to highways are exposed to levels that are, in some cases, twice as high as other urban neighborhoods. So none of these effects and none of these pollutant levels are accounted for in the 2008 EIS, for example. They've refused to look at health effects altogether, not being willing to investigate any of these possible relationships between the presence of a highway in a community and what's happening to the health of that community. And most of the pollutants that EPA has now called out as being related to health effects in communities next to highways were omitted from the EIS. So one major question here is whether or not CDOT is going to step up to the plate and begin an honest evaluation of what highways do to community health, and whether they will even model the expected pollutant levels that will result when we expand the highway from 6 lanes to 10 primary traffic lanes and increase the traffic load in that corridor by 30 or 40%. Now, the mousetrap is the most polluted place in Colorado. There's 350,000 vehicles pass through the mousetrap every day. And it is near the RTD bus barn. It is just downwind from the refineries. It is just downwind from the Cherokee power plant. There is no place in Colorado that has more pollutant exposure than the communities next to the mousetrap. And one of the issues is whether or not we're even going to have the health department put a monitor in that location. We hope that will happen now that EPA is finally saying you must monitor next to highways, but it's still up to the state to decide where that monitor will go. We think it should be those communities that are the most exposed to pollution. But even if you put a monitor in place, that it only tells you what's there today. It doesn't tell you what will be there once the highway is widened and the traffic is increased. That needs to be evaluated too. So none of that was done in the 2008 analysis, and that will be one of the major issues that needs to be addressed in the NEPA process coming up. Thank you.
Bob, thank you very much for those very insightful and helpful commentaries. It's something that we should all be concerned about, and that's health.